Hi, welcome to Alternative Medicine Acupuncture. I am the acupuncture physician. My name is Ivo Georgiev, and follow me. We have a great case here where we have a patient in the room already lying down for a back pain. There we go. Come on in. How you doing, sir? You doing okay? Okay, we're gonna prepare some injections for you, some homeopathic injections. So the best combination, the most simple one, is Zil and Tromil. These two, we mix them together. And what I like to use in general is a filter needle, at least 18 gauge. I mean, you can use 20, 22 gauge, that's your preference. As you all can see, there is a little green dot. You want to break it the opposite way. This is our clean field. You want to prepare a clean field where you are going to perform your procedure. It could be outside of the patient room. It doesn't have to be in the patient room. Okay, so that's that. Now, I already have my thin clip, meaning everything is already prepared for us. So this is about 1.5 mil. So I'm probably gonna do the same thing. You can do a ratio of 1:1 and then 1 cc of saline. That's a good mixture as well. I like to do 1.5 of each. So a good series is about 10 treatments every other day or every 2 days for a chronic back pain. And what you do is pretty much you inject the local acupuncture points. So in our case, we already have the needles in there, so it's obviously showing where those points are. That's urinary bladder 23, that's the eyes of the hips, the UL, and then we can, this is already clean for us, but if you want to clean it again, you want to take out all the bubbles. So you can do intramuscular, you can do intradermal technique. Either way, I like intramuscular. So this is a 30 gauge needle. You can do 27 gauge needle, 25. Obviously you don't want to hurt your patient, so you really want to go with as small as possible. Some people go 32 gauge, either way is fine. Again, I go right next to the point and you do about 1/2 mil. Same thing, 1/2 mil. You can go up to 1 cent, 1.5 cent. Obviously you need a bigger needle, but the idea here is not how deep you go, but you have an active point that actually is used for transmission of this medicine. So the Ziltromil are used for any chronic pain, acute pain, inflammation, any spinal issues. So if you were to use for the spinal, what you need to do is find the Giaggi point. So as you know, the Giaggi point is a 0.5 cent from the spine, between right here, the vertebrae. So you poke it right there. Then you find it right here, same thing. And what you really like to do is change the needle because it's already probably dull. So you don't want to hurt your patient. You change after 4 or 5 injections. Same thing. Make sure no bubble. And continue your injection. As you all know, this is UB31, which is one of my favorite points for any low back pain, sciatic pain. Okay. And that's it. That's your injection protocol, which would include the UB channel, You can use tongue protocol and use some of the hand points to inject. So realistically, you can use anything that has the acupoint, and it's still effective, actually very effective. Once again, every other day is the way to do it. You go about 10 treatments for a chronic back pain, and then you give it at least a week of a break. And if the patient is still having some issue, you put him back on a maybe 6-8 treatment protocol. Thank you for watching. Once again, my name is Ivailo Georgiev, and I'm acupuncture physician with Alternative Medicine Acupuncture.